Hello, my name is Anastasia Sidorova, and I'm a data scientist with a specialization in BIA, and I'm a junior, and recently I've been interested in the medical field, but more specifically in the context of biostatistics. So I did some digging on Kaggle and found the schizophrenia dataset. This dataset caught my eye because I was always fascinated by mental diseases and how they develop over time. This dataset has approximately 10,000 patient data. It has many useful fields that I will be using for my analysis. And some of those fields are education level, marital status, occupation, income level, living area, diagnosis, hospitalizations, family history, substance use, suicide attempt, positive and negative symptom scores, GIF score, social support, stress factors, medical adherence, and I picked those fields because I thought they would give us valuable insights into how this medical disease is formed and how it impacts individuals. So some of the questions that I came up with are: number one, does urban or rural living impact medication adherence, substance use, and suicide attempt? How does marital status and social support influence stress level? Number three, is there a correlation between suicide attempts and hospitalization frequency? So we're going to start off by looking at our data set. So for some of these variables like gender, education, marital status, occupation, income, and living area, they were binary. So I had to convert them to strings so it could be used in my analysis and it could help better understand our findings. And that's true for social support, stress factors, and medical adherence as well. Moving on to our storyboard. So we're going to start off by looking at our table over here. This table has positive symptom scores and negative as hospitalizations, GIF score, disease duration, and the total count of patients. In each category, we have employed, student, retired, and unemployed. So at first glance, it's pretty obvious that most of these numbers are very similar, except for employment that have slightly bigger amount of patients, which then influences the rest of the variables. Moving on to answer our first question, which is, does urban or rural living impact medication adherence, substance use, and suicide attempt? So if we look at the living/area medication adherence, we can see that, like I said before, most of the data is very similar. In each category have the same numbers or very approximately the same numbers, so you're not going to see a difference right away. But if we take a closer look, and we take a look at the medication adherence on poor, and if we look at no substance use, and if we look at suicide attempt, people that have had a suicide attempt, we can see that there's actually a bigger count of individuals who don't use substance use that actually have a higher rate of a suicide attempt compared to those who do use substances. Moving on, this is going to be our graph that answers the question, how does marital status, social support, and social support influence stress level. So if we set the social support on high and we look at the high stress factors and the married category, there is the amount of individuals is higher compared to the rest of the categories and the rest of the stress factors. Moving on to answer our last question, which is there a correlation between suicide attempts and hospitalization frequency? So if we take a look at the suicide versus hospitalization graph, we can see that the people who have not had a suicide attempt that were hospitalized is about 1,553, and the people who have had suicide attempts is about half that size, so 806. So to answer our questions, our three main questions, does urban rural living impact medication adherence, substance use, and suicide attempt? So if the medication adherence is poor, then yes, the rural living area does have slightly more compared to urban. If we look at moderate, it's going to be also rural is going to have more. And if we look at good, rural is also has more. So yes, it does impact. To answer our second question, how does marital status and social support influence stress level? So high social support and high stress factors do influence the married category, but not the single as much. And our last question, is there a correlation between suicide attempts and hospitalization frequency? Yes, there is a correlation. There's always gonna be less suicide attempts in every medication adherence, but it is highest in poor. So what did we learn? I should have picked a data set that was more versatile or had different numbers, and each category didn't have like the same findings. There wasn't very much variance in each category, so it was a bit difficult to work with. I'll keep that in mind and definitely pick a more interesting data set, or maybe use more data sets instead of just one. But